So guys, it is TuketheDuke here, and this is a special video because it marks 2 years after my thyroid cancer thyroidectomy surgery. So let's look back and see how things have recovered. So 2 years ago the surgery was on the 27th of August, and so today is the 31st. And I've got a couple of pictures lined up on the computer, and so we'll go through those ones. And the first one was taken on the 1st of September, so which is tomorrow. Still at hospital, and I still got the bandage here where they had the tracheostomia, and there's still the tape here because I've still got the staples in. So as you can see, there was a lot of swelling here, and I mean like a lot of swelling here, so it's a bit red, irritated I would say. So this picture was taken on the 5th of September, and it shows the remains of where the breathing tube had been. Yeah, and that picture looks a bit grim. It was infected, I think, a little bit, and doesn't look too nice. The track hole took quite a long time to recover, so I'd say like 2 or 3 weeks, and we made the mistake of not applying enough pressure, so air was constantly able to come out of it, and that prolonged the recovery. So the next picture was taken on the 6th of September, and you can see the outline of the scar, and you can see where the staples used to be, so there are the little holes on each side of the scar. And down below here you can also see where the drains used to be, so there were 3 of them and the other ones on the other side. And then we can skip forward a couple of months, so to November, and on the 25th of November my neck looked like this. So you can see that the scar has improved quite a lot. You can't see the marks from the staples anymore, and the swelling has also gone down. And then we continue down memory lane onto radiotherapy. So although not strictly related to the surgery, it's also had a lot to do with the neck area and the improvements, and it sort of slowed down the process. So in this picture, which was taken on the 27th of December, you can see the aftermath of the radiation. So the skin is in quite bad condition. So it looks like the skin is dying, and it's really dry and hard, and so this lasted for a couple of weeks. And in this picture, which was pretty much the final phase of radiotherapy, you can see that the skin is starting to peel off, and there is new skin under there which is starting to come out. So it doesn't look that tasty. And then fast forward today, so 2 years afterwards, and I'll quickly show you around what it looks like today. So we'll keep this PG-13. And this side suffered a bit more, so it's a little more stretched than the other side, but still it's recovered quite nicely. So you can still see that the skin here is it's quite tight, it doesn't give much, and this is the tightest place of all, so it really restricts my neck movement, so I still can't move my neck that high up. And there's also a little bit of swelling here still. I'm still going through lymph therapy to get rid of that, so that's really helpful. So they massage the areas to get the swelling away and get the fluids moving into other places where there is better movement. And pretty much everything else has returned back to normal, thankfully. So eating is okay, smiling is now equal. It's not like that like it was. Some feeling has returned back into my ear, so no point getting an earring anymore. It's too late for that. There's still some numbness and some swelling on my shoulders, but that's just how it is now. It doesn't bother me in any way. It doesn't affect me at all. And both my shoulders work normally. And there used to be the problem that I couldn't lift it up more than here, but with physiotherapy and a lot of practice, that became better as well. Talking is easy, and I think that's pretty much everything that I had problems with. And just on another side note, how the treatments are going, so everything should be okay here. They took a couple of pictures, and there's nothing out of the ordinary, as they would say. So the next checkup and pictures are in November, so fingers crossed nothing has changed till then, and life can continue as it is. Yep, so thanks for watching. TuketheDuke out. See you in the next video.